Are you ready to unlock the secrets of achieving high marks in the ESIC exam? Join me on a journey of discovery as we delve into ESIC exam preparation. So, welcome to our rewriting of integumentary system MCQs. Get ready to challenge your knowledge, master new concepts, and embark on an exciting adventure towards success. So, grab your study materials, buckle up, and let's conquer the ESIC exam together. Let's get started. The largest organ of the body, and the options are liver, skin, heart, kidney. Can you guess the answer? It is skin. The next question is, the skin functions are except protection, sensation, heat regulation, nutrition synthesis. Can you guess the answer? And the answer is nutrition synthesis. The next question is, the layers of the skin are except epidermis, dermis, hypodermis, stratum granulosum. If you know the answer, please type in the comment section. And the answer is stratus granulosum. It is the one of the layer of the epidermis. And the next question is, the skin lesion, which is a flat, non-palpable, discolored area of skin than 1 centimeter wide that involve any change in thickness or texture of the skin. So the options they are given is A. Maculae, then papulae, pustule, cyst. If you know the answer, please write it in the comment section. And the answer is maculae. Next question is, a lesion is a circumscribed solid elevation of skin with no visible fluid varying size from pinhead to 1 centimeter. So what we call that lesion? Options are maculae, papulae, pustule, cyst. And the answer is papulae. And the rest of the things like pustule is pus formation in the vesicles. Okay, it is a pus filled vesicle, and cyst is a sac like pocket of tissues that contain fluid, air or other substance. And the next question is, a lesion is a growth that may be filled with inflamed tissue or fluid or both to form a lump under the skin. And the options they are given is nodule, wheal, vesicle bullae and ulcer. Can you guess? And the answer is nodule. So other things are like wheal, it is a temporary raised bubble under the skin due to the intradermal infection. And vesicle bullae, it is a elevated skin with covered with a fluid filled. Okay. Then ulcers are the skin loss extending the past epidermis. And the next question is, which one is called shedding flakes of greasy keratinized skin tissue called? Options they are given is scales, crust, scars, keloid. If you know the answer, please comment. And the answer is scales. So, other that is crust, it is an encrusting deposit of dry blood, serum, cellular debris, pus and bacteria present over the skin surface. That is called crust. Scars are flat, irregular area of connective tissue which is left after a lesion or a wound has healed. Keloids are the elevated, irregular, darkened area of excess scar tissue which is caused by the excessive collagen formation during healing process. For crust example, it is eczema. Okay, it looks like a cellular debris. The scar look like this. The keloid look like this. It is elevated, irregular, darkened area of excessive scar tissue. Next question is, the lesion which is round or irregular macular lesion which looks like larger than petechiae. And the options they have given is ecchymosis, telangiectasia, petechiae, edema. If you know the answer, please type in the comment section. Okay, and the answer is, any guess? It is ecchymosis. Picture of ecchymosis. Petechiae are pinpoint round spots approximately 1 to 3 mm in diameter that appears on the skin as a result of bleeding under the skin. So the petechiae look like this. So this is the picture of telangiectasia. It is a small widened blood vessels on the skin and they are meaningless, but it may be mostly associated with the several diseases and common areas like lips, nose, eyes, fingers and oral cavities. There we can see this symptom. And the next question is the lesion which looks like a patch or raised lesion on the skin or mucous membrane and it is 1 centimeter in diameter. And the options they are given is pustule, bulla, pulque and cyst. You already know what is pustule and cyst. Here two new words we are able to see. So can you guess the answer? It is the answer is pulque. And pulque is the example of psoriasis and it is primary lesion. The pic of the psoriasis on leg. And the next question is the primary lesions of skin except are the options they have given is bulla, pustule, wheal, crust. Can you guess the answer? The answer is crust because bulla is a fluid filled vesicle which can seen in burns, contact dermatitis. Pustules we will see in the impetigo, scabies and acne. Wheal symptom is seen in the insect bites. Okay, these are all the primary lesions. And the secondary crust is the secondary lesion because it is formed by when the patient is infected by the dermatitis impetigo. And the next question is the secondary lesions of the skin are except the options they have given is scale, crust, excoriation, papule. And the answer is papule. And the next question is, it is highly contagious superficial infection of skin characterized by the red spots on the face. And the options are impetigo, herpes simplex, herpes zoster, pemphigus. Can you guess the answer? And the answer is impetigo. This is herpes simplex. It is a common viral infection of the skin that tends to recur repeatedly and it is also called fever blister or cold sore. And this is herpes zoster which is also known as shingles and it is acute inflammatory and infectious disorder, produces a painful vesicular eruption of red edematous plaques along the distribution of nerves from one or more posterior ganglia. And this is pemphigus. It is a group of dermatological disorders causing formation of blisters and pus-filled bumps on the skin. And the next question is a very itchy skin caused by tiny mites that burrow into the skin. And the options are scabies, dermatitis, acne vulgaris, pemphigus. Okay, any guess? And the answer is scabies. Dermatitis is the inflammation of the upper layer of the skin causing itching, blisters, redness, swelling, often oozing, scabbing and scaling. Acne vulgaris is a common disorder of sebaceous hair and sebaceous structure as they opens to the skin surface through pores and these glands produce sebum and lipid substances. And the next question is it is a condition of allergic disease characterized by itchy, rough, inflamed and cracked skin. And the options are eczema, dermatosis, psoriasis, dermatitis. And the option are, and the correct answer is, any guess? It is eczema. Dermatosis is the integumentary diseases which is caused by the bacterial, viral, fungal infection and genetic causes. Psoriasis is a chronic, non-infectious, recurrent erythematous inflammatory disorder which involves the keratin synthesis and characterized by raised, reddened, round, circumscribed plaques covered by silvery white scales. These are few important MCQs of integumentary system. I hope you like the video and gain some knowledge about the system. If you like it, please like, share and subscribe and comment. It will motivate me to do such videos. I will meet again in next video with a new topic. Until then, take care. Bye.